And he says, Jack, what you found here is amazing. He goes, can I send you a couple of patients to see if this would work? The first patient he sent me is somebody who had eosinophilic esophagitis, which is an autoimmune condition like you got, except it's in your esophagus. Did the same thing. This person had been to the Mayo Clinic, Johns Hopkins, and UCLA, Cedars-Sinai Medical Center. Got no answers. I did the Leptin prescription, the cold thermogenesis protocol. In 6 weeks, the patient had no more autoimmune condition. So this continued to happen. Then people started sending me all kinds of non-neurosurgical things, and people were getting better. Then I decided to do it on my son. Then I decided to do it on my nephew. My son, because at the time he was only 15, he lost 60 pounds in 6 weeks. My nephew, who was 21 years old at the time, his name is Kyle. He wanted to become an Army Ranger, but he was probably, I bet he was 100 pounds overweight. And he's pissed off with his life, low dopamine, nihilistic, like a lot of the kids today. And I said, Kyle, if you do this, I think you can do it. And he did it. He lost over 100 pounds, went into the military, and became a special forces guy. So that's when I said, okay, Don, you're right. I'm going to put this information on the internet. So what did I do? I took my decentralized medicine and put it on a website for everybody to look at themselves. That's how it started in 2005.
Wow. Yeah, I'm going to have to read that quilt document because, like I said, I haven't read that much yet, but I could tell that there was a lot lurking beneath the surface here. And some of it, to be honest, some of it I think obscured a little bit by the fact that, you've got kind of a reputation and people say that guy's weird, that guy's kooky, that guy's mean. And I guess I could see what they're talking about, but
Nick,
but
let me tell you something.
people are trying to hide stuff.
I got to say this because this is the perfect podcast to do it because you're a scientist. I don't think anybody is listening to this thing is kooky, but this is what I do have to say because this is truly how I feel. It's really ironic that people who are centralized PhDs and clinicians call me crazy when you're just too fucking stupid and ignorant to know that I'm right. And let me just tell you something. When you find out that a crazy motherfucker is right, then you may find out why I'm so angry and so pissed off that this story was first found by Robert O. Becker in the 1960s and buried from me, my friend. You want to know why Kevin McKiernan and I are birds of a feather? Because the things that he found about SV40, he never finds out unless I tell the story about where SV40 really came from when I did that podcast with Danny Jones, because I was at the university where all that stuff happened.
Well, for those that are are going to be listening, can you just briefly explain what SV40 is so they know?
Yeah, SV40 is a simian virus. There was many of them found that originally was placed in the polio vaccine by mistake. It's famously categorized in something that most of you probably never learned about called the Cutter event. The Cutter event occurred at Ochsner Medical Foundation Hospital where I did my residency. Alton Ochsner got the whole entire medical staff together, injected his grandchildren with the Cutter polio vaccine. That's the Salk version. His grandson died in 8 days. His granddaughter got polio in her leg. She didn't die. And that kind of changed everything in 1951. Eventually, a very brilliant doctor, who's the first doctor that I can tell you was canceled before Becker, which is Bernice Eddy. This is all the science that Kevin never could know. Bernice Eddy's the one that found that simian viruses were in the polio vaccine. Why? Because the polio vaccine that Salk created was very difficult to grow. And remember, this all went on when FDR was the president in the 30s, 40s, and 50s. This is in a pre-molecular biology age. Remember, DNA is discovered in 53. This happened in 51. So when he grew the polio vaccine on monkey kidney cells, he had no way of knowing. He was transfecting their viruses onto that vaccine. That vaccine then was given to about 360 million people all over the world. Then the blood supply was polluted. So everybody got it. What did we then find? The government knew. In 1951, Richard Nixon was put in charge of this as the vice president for Eisenhower. He was very good friends with Alton Ochsner. Alton Ochsner was a very famous anti-cancer doctor. Turned out that they found out that when you irradiate SV40, it becomes more lethal, meaning more cancerous. It's an oncogenic virus. And what happens then in history? The first clandestine bioweapons lab is opened up in New Orleans. There's 5 different labs. Alton Oshner gets a LINAC, linear accelerator, to try to get rid of the SV40 from these animals to see if we can reverse this process, because Alton Oshner and everybody else in the military knows that cancer is going to spike over the next 50 years, which it does. That's what the old SV40 story is. So if you want to know about soft tissue cancers and mesothelioma, really where they come from, it's not from asbestos. That's the story you've been sold. And the real story is that there's this huge spike in the literature of SV40. Kevin and his former critic, Philip Buchholz, who's a molecular biologist, had no way of knowing this story. Why? Because the NIH, through Bernice Eddy's bosses, whitewashed the whole story from 51 through 59. It only comes out in the wash when Bernice Eddy in 1957 is at a New York Academy of Science meeting and casually says at the end of it, this is a closed door meeting to guys like you, that, by the way, the polio vaccine is polluted with SV40 and a lot of other polyoma virus. Remember, SV40 stands for 40. There's a whole bunch of other ones.
Right.
Okay. So this whole entire thing is whitewashed from the NIH website. Nobody studies it until a guy named Michael Carbone in the early 90s that I become familiar with, who's a PhD researcher, starts to look into this mesothelioma story. And he finds a surgeon in Washington, D.C., who's got the largest case history in the world of taking mesotheliomas out of chest cavities. And he had this propensity to do something unusual. He'd save some of the tumor himself. So Carbone goes back and gets over 400 samples and finds out that the majority of these mesotheliomas have remnants and pieces and parts of SV40 in them. This get buried in history, but you can still find it. But nobody has ever been able to link this story to the Oshner story. Why? Because the Oshner story was a CIA, FBI clandestine operation. So how did Kevin get dragged into this story? Unfortunately, I've never told this publicly, but yeah, part of the reason I went back to work in COVID was not only to try to save people from the graves, but it was to get samples of one specific vaccine that I knew was going to have SV40 in it because of the patents. The patents for BioNTech and Pfizer, 2 different legal definitions. And I knew exactly what they were going to do based on the patents from Moderna. They were going to go down to their genetics lab and they were going to get the SV40 promoter because they were behind the COVID scene, and they would use it and then take it out, utilizing molecular techniques. Now, I'm a pretty smart guy, but I don't have any of that skill set. So you happen to know a guy in the cannabis industry that's a pretty fucking smart cookie that used to work on the Human Genome Project. Magically, he gets a couple of vials, and just by accident, he doesn't check them. He waits till he has his own problem in his own company and says, I need something that can do this molecular trick for me. He goes, oh yeah, I got these Pfizer vials.
Yep.
He uses them, finds out that SV40's in it. He goes on Twitter, you know the story, tells everybody. Everybody tells him he's fucking crazy. Philip Buchholz goes fucking nuts on him. You know, they get into a huge fight. I'm sitting back watching this whole thing, and I'm going, okay, let's just go to the next step. Philip, get off your ass, be a fucking PhD scientist, and do what you need to do. And he did. He tried to prove Kevin wrong by stuffing tube socks in his mouth, repeated the same fucking study, and guess what happened? Kevin's right. Uncle Jack smiles. Okay? Now, Uncle Jack, who never tells this story for 30 years because I've been sitting on it, for how I laid the story out on the Danny Jones podcast, on Rick's podcast, on the Bulwark podcast, now your podcast, Dr. Alexis Cowan, who's also a PhD researcher. Like, now the entire story's out. Why? Because what happens? Magically, something that's supposed to be new in science, which is the MRI platform, has something old from 1951 in it.
Yep.
Okay?
SV40 promoter.
And guess what? At the end of my last podcast that I did with Danny Jones, that was me and Mary Talley Bowden. I just want you to go look at this, Nick. I put up one slide, and I show you the slide of the SV40 story, the 50-year spike of cancer, and it ends right where COVID is. But here's the most important part. The SV40 in the polio vaccine is a full complement of the genome. It's got everything in it. The SV40 that's in the COVID mRNA platform only is the promoter. That's
Yes.
it. Nothing else is in it. I want you to go look at the slope of the line on that slide. You'll see that it's asymptotic compared to the other one, which is sloped.